Hey everyone, this is Dr. Connie. Welcome to my show, Mind Your Hot podcast. Today I want to talk to you guys about a very common problem that you actually might have. I want to talk about diastasis recti. And it is a condition where the two sides of the rectus abdominis, your six-pack muscle, in your abdomen separate or spread apart. It's a fascia that holds it together that separates. And this separation occurs along the linea alba, a connective tissue much like collagenous tissue that runs down the middle of the abdomen. And when this happens, you can have a bulge, you can have a pooch that never goes away no matter what. And you might even have various symptoms, and you may not even suspect that you have this. Diastasis recti is a common condition, very common, that can occur in both men and women. I've seen it both, but it is particularly common in pregnant women and postpartum women. Even the skinniest, tiniest, petite women have diastasis recti, more than 2 finger width. I've even seen 3. And when this separation of the connective tissue occurs right in the center of your abdomen or along your rectus abdominis, your six-pack muscle, it sort of like loosens the bolts, if you will, and everything around it to stabilize is completely diminished. Not only that, it can cause a lot of digestive issues. So it can become very systemic. The condition can be caused by a variety of factors, including pregnancy, childbirth, weight gain, abdominal muscle exercises done incorrectly, and heavy lifting. Diastasis recti can cause a protruding belly, low back pain, poor posture, and difficulty with core strength. No matter how hard you try, like certain core weakness some people just have, this might be why. And it can affect your stability. And in severe cases, surgery may be needed to repair the rest separation of this muscle. The prevalence, it's very common, like I said, of diastasis recti varies depending on the population. But among the studied, the diagnostic criteria used to define it, those are the variables that we look at in various research studies. And studies have actually found that diastasis recti is most common in pregnant women with prevalence rate up to 60 to 70% in the third trimester. Postpartum, the prevalence of diastasis recti ranges from 35 to 60%, which is astounding, with higher rates in women who have had multiple pregnancies or delivered larger babies. It's important to note that I am a women's health specializing, I'm a doctor of physical therapist specialized in women's health, which include pelvic floor dysfunctions, prolapses, different urinary incontinences, sexual difficulties with penetration or too loose, whatever. It's all a muscle, you guys, if you think about it. And it's really clinically significant, especially postpartum. And it's important to note that not all cases of diastasis recti are clinically significant or require treatment, but I've seen a lot of normal yogis in my yoga studio and colleagues have this separation. They've never known it. They just assumed that it was a bulge from pregnancy. And they do a lot of running, they do a lot of yoga, they do a lot of high intensity, but with very little fat and really a lot of muscle tissue. There's a 3 finger separation in this right around the belly. You can actually measure it. So if you do a sit up and you put your fingers like this into your belly button, just like this, you will feel a separation right along the sides of it. And if you do have it, when you pull up into like a sit-up position, it'll separate. And unless you pull it together to stabilize and do proper exercises to close that gap, you're going to always have this gaping pooch that you can't treat. And it doesn't look very cosmetically pleasing. How do I know? Because I've had that. I've had an umbilical hernia after my second pregnancy, and it would balloon up. And I used to have a lot of digestive discomfort, a lot of gas, bloating, embarrassing, and a pooch that would never go away, even though I lost all my weight. And it just felt so bad. And I used to think this is why people do cosmetic surgery or tummy tucks, because it was so ugly. And then I went to go see a general surgeon. I did some research. And in fact, I learned, and that's when I started to learn over 17 years ago, women's health pelvic floor physical therapy. And that's where I learned all about the vaginal rehabilitation that we all should have, because we lose the contractibility down there. And then really intercourse, the sensations. And, when we have loose muscles, there's really lack of climax. All those things come into play that I won't go into here, but it's a topic of real issue for many women, but we don't talk about it enough because we're so embarrassed by it. So I just want you to know that separation needs to be looked at. You need to pay more mindful attention to it, because it's easily something that you can close the gap on if you do proper exercising and with proper awareness. So some degree of separation of the abdominal muscle is normal during pregnancy and can resolve on its own postpartum. However, in some cases where diastasis recti can cause discomfort, pain, or other symptoms, treatment may be necessary. And there are tons of treatments that you can get. And as a physical or women's health physical therapist treating pelvic floor dysfunctions for over 25 years, I've seen one too many women who have diastasis recti, but never knew that they had it. Like I said, I too had it, and it caused so much digestive discomfort that I chose to get it fixed. Typically, women complain of a bulge in their tummy, and that won't go away no matter how much they exercise and diet. And I will note that it's considered a cosmetic surgery in the conventional medical setting, but because I had a hernia, umbilical hernia, they made it medically necessary, and my general surgeon did me a favor and fixed it altogether in one surgery, fixing the umbilical hernia. Otherwise, it's considered cosmetic. And I can tell you, it made a huge difference after I had this surgery. Typically, women complain of a bulge in their tummy that won't go away no matter how much they exercise and diet. It can cause gas and bloating and constipation. And they also complain of weak abdominal muscles as well. These are all common things that women experience, especially after postpartum. And I can tell you, a lot of women find out about it like 10 years later, 20 years later. And I will tell you, when this issue is unchecked, goes unnoticed over the years, I've had women in their 60s and 70s with prolapse so bad. Prolapse is your ovaries and uterus just hanging out of your vajayjay, and it's crusty and dried up like you have something coming out of your vajayjay. It's not very attractive. But again, women are so afraid of it and so embarrassed of it. Not to mention the urinary incontinence. And I will tell you, if you do your abdominal exercise incorrectly, you're bearing down, making it worse every single day, every time you go poop, every time you go exercise unknowingly. And that's what I want to bring attention to all of you guys listening, so that you can be better equipped to handle this or treat it on your own, because it's treatable. So the pregnancy and the weight gain coupled with C-section further complicates this problem, because the incision made is horizontal. It's cut. Your transversus abdominis is cut on the lower abdomen, and it can cause more weakness. A lot of women complain of like numbness around there. They can't even contract the pelvic floor. So it's a problem, because when I ask them to contract and I do a vaginal examination, they're bearing down, meaning every time that they think they're contracting, doing a Kegel, because that's another thing. Doctors just send you home, do Kegels. But are you doing it correctly is the question, right? So if you have constipation, you have gas and bloating, this might be a mechanical issue that can be easily fixed. So I went off on tangent, pardon me. The problem is that physicians don't necessarily check this issue unless patient complains. And from my experience, women are so busy postpartum, right? And most of them assume that it's all part of pregnancy, so much so that they don't really complain. And this is why I chose to specialize in women's health after my second son was born, because it was a huge problem for many women, including myself. Treatment for diastasis recti usually involves exercises to strengthen the deep core muscles and improve the alignment of the body. A physical therapist trained in women's health and pelvic floor dysfunction can help women strengthen their pelvic floor, which is part of the core musculature. Okay. Pelvic floor is part of your core. Pelvic floor at the bottom, diaphragm at the top. In the front is not the rectus abdominis, but it's the transversus abdominis to the sides of your abdomen that stabilizes. And then there is the deepest part of your lumbar muscles on the backside, which is the multifidi. Those four muscles are your core muscles. And yes, your pelvic floor is part of it, as well as your core, right? Or as well as your abdominis, transversus abdominis on the front side. And if your rectus abdominis, which is a six-pack muscle, it's separated, it's harder to pull together. So I've seen the trend is that there are many OB/GYN offices now offering pelvic floor strengthening services through a computer-generated electrode, which involve a vaginal electrode used as a biofeedback to help women strengthen their muscles. This is what we do too in physical therapy, but we're a lot more functional. In my experience, your best option would be to seek a trained pelvic floor physical therapist who can manually help you comprehensively. They would need to do an internal examination just as an OB/GYN would and assess your prolapse if you have any, as well as your strength. And because all we are told is to do Kegels, how many of you actually know how to do Kegels, right? Because I've seen one too many women do it incorrectly, and I'm sure you're not even sure if you're doing it correctly. I've seen clinically that women bear down, like I told you, rather than pulling up, causing pelvic floor prolapse to worsen. And problems can really be exacerbated down the road. So, how does your diastasis recti affect you exactly? Well, the separation of the abdominal muscles can cause protruding belly or a pooch that is difficult to flatten with exercises or diet, like I said. And this can cause body image issues, low self esteem, and emotional distress, not to mention back bends in yoga or any other exercises that you do. You might be gapping it more and more and more, especially when you're doing like a back bend, right? And in addition, diastasis recti can cause physical symptoms like back pain, poor posture, no matter how hard you try, and difficulty with core strength and stability. The weakened abdominal muscles may also contribute to urinary and fecal incontinence. Yes, it's possible. And other pelvic floor dysfunctions. Urinary and fecal incontinence is when women have no control over their bowels and or urine. They leak when coughing or running. I've seen both women after postpartum, they start to leak urine or feces, and it can be very embarrassing because they are so embarrassed they maybe don't even seek care because it's like, oh no. It's like as if we hide it, it'll go away. But for some people, diastasis recti can interfere with activities of daily living and limit their ability to engage in physical exercises or activities. And in severe cases, diastasis recti can contribute to a hernia or other abdominal wall defects, like I had. In pregnant women, diastasis recti can lead to complications during pregnancy, like increased risk in back pain, pelvic pain, and urinary incontinence. I know I'm saying this over and over again, but I just really want you guys to understand that if you're experiencing this, it may be might be the culprit. And so, yes, you might have a pelvic floor issue, but it doesn't work and function on its own. It works with the core, right? The whole core is a diaphragm, pelvic floor, multifidi on the back, and then the abdominals on the front. So you have to really be mindful of integrating and putting it together as a whole, right? Resuming exercises like weightlifting, yoga, or even aerobic exercises without fixing the diastasis can cause repetitive injury. And I talked about repetitive injury and the implications of that being a systemic inflammatory culprit that can keep you from losing weight. So everything sort of comes together. And this is that pooch that you can never get back. It's not really the weight gain, but it might be the systemic inflammation plus the mechanical disruption of your belly, right? So all things go together, affecting your digestive capabilities. And you need to be aware because many specialists specialize in different parts of the body. Nobody puts it whole. So it's my thing is I really want to put it all together to let you know you've got power over this. You can fix this on your own if you're mindful and if you can be committed and educated enough to know and apply all things that I'm sharing with you. Because if it's bad enough, it can really warrant surgery to fix, especially if it gets worse and it gets in the way of your life like it had mine. As I mentioned, diastasis can affect your gut health. Some studies have suggested that diastasis can contribute to a weak abdominal wall and decreased intra-abdominal pressure, which may lead to altered gut function and even digestion. This all makes sense. This can potentially cause symptoms like bloating, constipation, and discomfort. So it may not be your diet even. In addition, some research has suggested that diastasis recti can contribute to a weakened pelvic floor, which may lead to pelvic organ prolapse and urinary incontinence. And these conditions can cause digestive symptoms such as constipation and difficulty with bowel movements. In a study published in the Journal of Women's Health Physical Therapy, researchers found that women with diastasis recti had a higher prevalence of constipation compared to women without diastasis recti. The research hypothesized that the weakened abdominal muscles in women with diastasis recti can and may contribute to decreased intra-abdominal pressure and altered gut function, leading to constipation. And in a study published in the Journal of Obstetrics and Gynecology, researchers actually found that women with diastasis recti were more likely to have pelvic organ prolapse, a condition, like I explained, in which the pelvic organs, like your uterus, bladder, and the rectum, bulge into the vagina. And pelvic organ prolapse is known to be associated with gastrointestinal symptoms like constipation and difficulty with bowel movement. But think about this: sexual dysfunction, your intimacy, your self confidence, that all adds to the stress of your life, right? It's a lot of shame and guilt. We don't need that. And that feeds our inflammatory cycle, which is why I want to talk about this more. In a case report published in the Journal of Bodywork and Movement Therapies, a patient with diastasis recti and chronic constipation was successfully treated with a program of abdominal exercises, deep breathing, and manual therapy. The researchers hypothesized that the abdominal exercise helped to improve intra-abdominal pressure and stimulate gut motility, leading to improved bowel function. If you suspect you have diastasis, you may ask your doctor for a referral to a trained physical therapist. Or if you want to learn more from me, please follow for more. My link is in the bio, and I help women all over the world. You can also follow me for more, as I've seen diastasis recti in the strongest of the yogis, like I said, who's given birth and didn't know they had it until it began to cause low back pain. It's important to properly activate the core, which involves the four muscles, like I said, the deep transversus abdominis, the multifidi pelvic floor, and the diaphragm. So they span the top, the front, and the bottom, front and back. And when contracting core properly, it's not just the abdominal muscles, it's all of it together. The breathing that goes into it. And that's why I love yoga so much, because it connects everything. And you guys know I'm a nationally certified Pilates instructor as well. So all these things really emphasize the importance of core stability for foundation of any movement. And you guys, movement is medicine, food is medicine, your thoughts are medicine, or positive thoughts are. I have many core centered yoga, Pilates, and physical therapy based home exercises that you can do to strengthen your core. So follow me on YouTube at Dr. Connie Chung, and really follow me at Instagram and TikTok, as well as subscribe to my channel here at Mind Your Health Podcast. I really do hope that you found this episode helpful, and I believe this is one thing that you can do and be aware of to prevent more issues down the line. And my job, my passion is to connect the physiological, the physical, mechanical aspects with the systemic biochemical aspects, as well as the psychological aspects, to really pull you whole and you understand that you're in control, that all things are just not one thing. It's not outside of us. Unless we really work to heal ourselves from within, healing is an inside job, and it starts with our inner awareness and our inner knowing. And then from that place of knowing, we then can seek and effectively and powerfully elicit these powerful modalities to really boost our health and wellness. And in that way, we would never need a doctor, to prescribe us medications or otherwise, and be dependent on other people to help us to get well, because wellness is really a state of being. Always remember that. Thank you so much for watching or listening, and I hope you find this helpful. So DM me, find me, and subscribe and follow me for more. Thanks so much, you guys. Bye.